Welcome back. This is Pain to Power, where we turn physical setbacks into comebacks so you can get back to doing what you love. And for me, that's golf. In today's video, I'm going to provide a week 7 update on the intensive 12-week program I started to heal my degenerative disc disease, sciatic pain, and hip arthritis. Let's head on over to the PowerPoint and dive in. Okay, like every one of my other videos, we start with a quick recap of the program. This is a 12-week program that's heavily predicated on robotic laser decompression. So in month 1, you do 3 sessions a week of robotic laser decompression, RLD. You do neuromuscular retraining, re-education twice in the first month. In the second month, we drop down to twice a week for our RLD sessions. You meet with the physical therapist one more time. And then in month 3, that drops down to 1 time a month for RLD and one more chance to meet with the physical therapist to get my maintenance exercises set up going forward. Every week, I do a check-in with Dr. Zielonka, which usually includes a chiropractic adjustment, but lately has also included some ART therapy to help with some nerve pain. And I'll get into that when we review the progress. Of course, there's changes to diet, right, and supplementation, and a whole host of exercises that I've shared on this channel. So that's the program overall. Let's get over to the week 7 update. So just completed week 7. So that was another 2 sessions. So I'm up to 18 sessions out of 24. I've met with I've met with the physical therapist 3 times now. And I continue to do my exercises and stretches almost every day. So I'd say 4 to 5 times a week, and I give it a break on the weekends. So trying to change it up a bit from the basic table formats and going to talk a bit about my pain progress. So trying something a little new, more of a map. I'm experiencing pain. So I used to experience pain in a number of places, right? I have a hip labral tear, so that means right in this area here it'd be painful. And down here in this blue shaded section, that's where I used to get that sciatic that just burned. And that could come while I was sitting or walking. It would flare up and could last 20 minutes, could last 15 minutes. But it was very uncomfortable, and I was forced to do all kinds of like chair gymnastics, trying to find a position that helped, and nothing helped. So about 3 weeks ago, I started noticing, hey, this I haven't had one of those episodes in a while, and it continues today. It's been easily 3 weeks. And while I still have some sciatic pain, and we'll talk about that, I do not have those flare-ups anymore. And I believe that is directly related to the robotic laser decompression sessions that I'm doing. As it was described to me, the idea is to pull you apart, create some negative pressure in those discs, essentially give them time to move apart as much as possible, then use an intense red light laser to help nourish those cells, and with the goal that, over time, I will have created that space in those discs that's relieving the sciatic nerve, which has been leading to the pain. And so, haven't had it at all. Now, that's not saying I don't have any sciatic pain. I still have sciatic pain. So if we look on the front, there is along the groin and like the inside of the thigh over the kneecap. It's interesting. It's very fine, kind of like feels like a rope that's being pulled. That happens when I'm walking. So I'm working on that. I'm sure it has something to do with the inflammation in my hip socket. And I also feel it on the outside of my leg, like on the quad, going over the kneecap again and into that shin area. But it's not that burning sensation. It's just, again, it feels like it feels like there's a string in my leg and it's being pulled, which I can only surmise is a nerve. Now I have some scales on here, like in general, the stiffness in my lower back. It's most prevalent when I'm twisting, but when I wake up in the morning, it's about a 5 out of 10, and I don't really notice it during the day, so that's good. The nerve pain I get while I'm walking, that's around a six ish, and then also while I'm walking, I will feel it in that section in my shin. It's really weird. It's just that one panel. It's the one side of the front of the shin. So that's where I'm at this week. It's, again, everything continues to move, I believe, in a positive direction. And, I'd be remiss if I don't talk a bit about how, where I'm getting these treatments. And so, shout out, as usual, to the great people at the Ottawa Chiropractic and Natural Health Center here in Ottawa. Dr. Zielonka and his team do a great job. They're the only clinic in the general Ottawa area that has this machine. It's a very special machine, and it's a pretty comprehensive program. So if you're dealing with sciatic pain and you want relief, I would encourage you to seek them out. They'll do an assessment and they'll help you understand what your options are. So that's it for this week. Thanks for coming along on this journey. It's only a couple weeks left and it'll be done. And then I'm going to start trying to find other people to bring on to this channel to talk about their journeys from some form of injury back to doing something that they love. So until then, thank you very much. Stay healthy, and I'll see you in the next video.